Well, I'm having a stroke. That happens a lot.
Did you get that?
How's it going, everybody?
Hey.
I'm Dr. Schierle, Director of Aesthetic Surgery for Northwestern Specialists in Plastic Surgery, here again with another informative video. We have with us today our newest physician assistant, Monika Cieszynski.
Hi, guys.
Today we're going to talk about in-office procedures. This is a topic that has been really blowing up lately. Even before the pandemic, we have noticed uptick and interest in-office procedures. And even in just a few months that you've been with us, I think that you've seen a number of these. What are some of the procedures that you've seen us doing in the office?
So I would say one of the most popular procedures, I've seen a lot of chin liposuction. I think it's up and coming. Everyone's super interested in that. You know, getting a nice chiseled jawline is everyone's want. So that's one great one. Another one is our upper blepharoplasty. So upper eyelid lift, opens up the eyes. A lot of the times as we get older, the upper eyelids tend to kind of sag over the eyes, obstructing vision. So that's been another one that I've seen as well, so that's been great.
Awesome, yeah, and I would definitely echo that. Those are two of our most popular procedures. In general, I think, in this era, there's just a lot of interest in people being able to do some things with the downtime that they have. Some of the other procedures that we've done in the office that a lot of people may not be aware of. The reverse tummy tuck, make sure to check that out on our Instagram. There's a really cool post about that. A breast lift, a lot of people aren't aware that a breast lift can actually often be accomplished under local anesthesia in the office. We have a number of non-surgical treatments like the profound skin tightening treatment, as well as our surgical hair restoration. Pretty much any procedure that involves local anesthesia where we're manipulating the skin and the soft tissues in a way that the patient is comfortable with can be done in the office. And you should definitely always feel free to ask your plastic surgeon if that's a possibility, because it can be a significant cost savings. What would you say are some of the biggest advantages to the in-office procedure that you've seen even just in your time with us?
Well, I think, it kind of skips that middleman having to go to a surgical center and be in the operating room, going under, general anesthesia. Local anesthesia is fantastic. Typically send some antibiotics to all of our patients and a Valium, which can help you relax during the procedure, and typically all of our patients do really well. Another advantage is, we can communicate with the patients throughout the entire procedure, answer all of their questions, and we play some great music, and Dr. Schierle loves to sing, so.
I'm not sure about that. That might require more medication for the patient if I was saying. Yeah, I would just echo all those comments. I think, a lot of people are really kind of put off by the idea of being put to sleep. It's a big part of the anxiety, the unknown, the uncertainty, and so they like the idea they can avoid the heavy medications, the heavier recovery. It is obviously more cost effective in the office because you're saving on the OR and the anesthesia costs. And so for all these reasons, it makes it seem like it's less of a big deal, which it really is. I always tell my patients, I can only do things in the office which are no big deal. And many of these procedures, surprising to many patients, are not that big a deal to us. If it's a big deal to them, we can certainly take them to the operating room and have some sedation and help them be a little bit more asleep. But many of our patients are up for the awake methodology of doing the procedure, and they find that it's far less anxiety provoking than they anticipated. Typically, it is the anticipation that's worst, and once we get things numbed up, I often tell people the numbing is often the worst part. Ironically, numbing medicine hurts. But once they're numb, the whole procedure really should be painless. They are not allowed to feel anything sharp or painful. And usually they'll tell us that it's less of a big deal than getting their teeth cleaned or things of that sort.
What would you say in terms of the numbing medication is most, how does it feel to most patients? What is their response to the numbing medication?
That's a great question. There is a wide range in terms of how people respond to that. I think you've seen even in just a few cases that you've assisted with. Some of the patients really just are super chill with the numbing. It's like no big deal. They're statues. It's incredible. And that can lull you into a little bit of a false sense of security. You think like, okay, I got this down. I know how to numb people up painlessly. But every once in a while, someone's going to be more sensitive, and it is going to be a little bit more uncomfortable for them. And so we do want to be mindful of that. We want patients to be aware of that. It's hard for us to really predict what your experience is going to be like. As long as you're prepared for those possibilities, we can get you through it. As you mentioned, the Valium, the relaxing medication, can sometimes help take the edge off so that it's less stressful.
Right. And then we also, in the numbing medication, it's mixed with epinephrine. Can you talk to our viewers about what that can do?
Yeah, the great thing about the epinephrine that we use, it does help with what's called vasoconstriction, which is basically going to help minimize bleeding and bruising as part of the procedure. It also lets us kind of see that the numbing is working, because when we put the numbing in, we let it soak for a few minutes. Really give it a chance to work well, and then you can actually see that part of the body that we're working on, whether it's the chin, the eyelids, whatever. It'll get a little pale, and so it's almost color-coded that we know this is a part of the body that's now comfortable, and that we're going to be able to get you through this procedure.
It's like a confirmation for you, like this is where I gotta go.
Yes, yeah, exactly. Well, I think that covers a lot of good stuff about in-office procedures. There's really no end to the procedures that we can perform. You know, the sky's the limit. Make sure to ask us during your consultation about that possibility, and it's definitely something you can learn more about by visiting our website. Make sure to subscribe for future videos to learn more. Hit that notification button so that you get all of our notifications, and we'd love to see you next time. Thanks for joining us on this socially distanced pandemic edition of NSPS information. Thank you.
Thanks,
Take
guys.
care.
Questioning our audience.
Make sure to leave a comment below.
Subscribe.
Smash that bell to get notifications.
Okay.
Hey guys, thanks for watching our video. Make sure to subscribe, follow us on Instagram, Facebook, and Twitter, and check out our next video.